Well, funnily enough for me, some of the milestones don't carry the name gender-based violence prevention, because some of the key milestones in education have been that we've invested in prevention education at all. And what we had, first of all, was a key milestone preventing alcohol-related violence and alcohol risk behaviours through the National Mental Health Strategy and the Victorian Turning the Tide Strategy, which was a government initiative. Then we had the focus on mental health through prevention education programs. Again, a national strategy, but also a Victorian strategy. But I think if we hadn't had that evidence that we can actually make a difference through prevention education, we would not have been possible to argue that we can do this prevention education work in schools. What we've had is this accelerating evidence base and approach to using schools as a setting for prevention. And let's acknowledge all those fundings didn't come from education, they came from health or somewhere else. So it's about the education sector responding to drivers and imperatives from somewhere else. And so what I would say the key milestones are the preparedness of the education department to partner with the other sectors to do that work, which has never been comfortable or easy, though always agreed to be important.
Okay, thanks. What about you, Justin?
Okay. I think also about the evidence base and just in government when you're looking to get money for things or get traction and support for things, the evidence base is incredibly critical. So to think about in the last decade, the establishment of Our Watch, Anne Rowe's work, some of the landmark pieces around the importance of prevention of family violence that Vic Health did a number of years ago. These are all things that are still invoked today in business cases and conversations in government. So there's an incredibly, that building of the evidence base. There are some of the formal organisations, but informed by so much of the work that prevention agencies, universities, response agencies have done over time. And I think for me, just the fact of the Royal Commission, so, being a bureaucrat, some of those milestones about, a government committing to a Royal Commission, having that process, and for us critically having a recommendation of a Royal Commission to implement respectful relationships in all government schools is just provides the foundation for everything that we're going to be doing.
And I think then ultimately probably the biggest milestone has been the department committing to actually taking on respectful relationships, because what I forgot to mention before was that when I started, my perspective and what seemed to be the perspective at the time, despite what had happened in the past that Pam had told me about, was that it was actually the community sector who was leading this work. And sometimes that was difficult, and sometimes it was difficult to get schools on board, and we were really doing that. So when that then became something the Department of Education was doing and to be mandated across schools, I think that's really, really great and really important.
I think from a broader social perspective too, there's been the Royal Commission can't be overestimated, and also the social conditions that led to the Royal Commission. And I want to talk about there's the kind of social activism that from people like Rosie Batty, and I think the influence of that in the popular culture can't be overestimated. We've got, instead of our issues and our processes being talked about in the health sector, in the community sector, in the school sector, they're now barbecue water cooler discussions, and they're in the public social space, the discussions about these kinds of things. So there's been a few of those crucial things that have come together to make the commitment, the work that we've got going on now so cohesive and so thorough.
Yeah. So that really strong focus, I think, is the kind of key thing that's coming through around the evidence base and the kind of the social and the cultural and the political context within which this has developed. And I think the interesting thing for me about the evidence base around respectful relationships is that it was a combination of a practice evidence base. I think we can often forget as we're talking about the last couple of years of the history of respectful relationships that some of this work was designed by Centres Against Sexual Assault. It was designed by Women's Health Services. It was designed by the people who were doing doing the work with victim survivors who were starting to translate that into primary prevention and get a prevention lens into what it was they're doing. And so programs like the SAPS program that a number of the Centres Against Sexual Assault ran, or Girls Talk Guys Talk, which was a women's health service program, those are the models that have contributed to the evidence base that our Watch Pilot project drew from. And so we've just kind of had this really slow but steady sequential building of both practice and academic evidence in this space.